What is status epilepticus and how do you respond? Imagine witnessing someone having a seizure that just won't stop. That's what we call status epilepticus, a serious medical emergency that needs quick action. It happens when a seizure lasts longer than 5 minutes or when multiple seizures occur back-to-back without the person regaining consciousness in between. This condition is one of the most urgent situations in epilepsy care because the longer it lasts, the higher the risk of brain damage, disability, or even death. The definition of status epilepticus has changed over time. Previously, doctors thought it was a seizure lasting 30 minutes or more. But recent guidelines now say that 5 minutes is enough to consider it a medical emergency. This is because brain injury can start happening well before the 30-minute mark. Acting fast helps limit damage and improves chances of recovery. There are different types of status epilepticus. The most obvious is convulsive status epilepticus. This is when someone has rhythmic shaking or jerking movements that last 5 minutes or more. They might also have trouble responding or be completely unresponsive. This form is easy to recognize because of the visible shaking and altered mental state. The other type is nonconvulsive status epilepticus. It's trickier because there are no obvious shaking movements. Instead, the person might seem confused, unresponsive, or just not acting normally. This type can last longer than 10 minutes and often requires an EEG, a special test that records brain activity to confirm the diagnosis. Because it's less obvious, it can be missed unless caregivers are very alert. Refractory status epilepticus is a more severe form that doesn't respond to initial medications. It accounts for about a third of all cases and needs more aggressive treatment in a hospital setting. Many factors can increase the risk of status epilepticus. The most common is not taking prescribed seizure medications properly. Other causes include alcohol use disorder, strokes, infections, metabolic imbalances, or brain injuries. Certain drugs or toxins can also trigger it in some people. If you see someone having a seizure that lasts longer than 5 minutes, or if they have multiple seizures without waking up in between, it's crucial to act immediately. First, make sure they are in a safe place. Remove any nearby objects that could cause injury. Gently turn them onto their side to keep their airway open and prevent choking on saliva or vomit. Do not restrain them or put anything in their mouth that can cause harm. Next, call emergency services right away. In the United States, dial 911 or your local emergency number. Tell the dispatcher you suspect status epilepticus and give your location clearly. While waiting for help, monitor their breathing and airway. If you are trained, be ready to provide rescue breathing or CPR if needed. Keep them on their side and stay with them until emergency responders arrive. If the person has been prescribed rescue medications like rectal diazepam, intranasal midazolam, or buccal midazolam, follow their seizure action plan or medical instructions to give these medications. They can help stop the seizure or prevent it from worsening. Remember to note the time the seizure started, as this information helps medical teams decide on treatment. Stay calm and reassure the person. Protect their privacy if possible. When emergency medical personnel arrive, they will take over. They may give additional medications, provide oxygen, and perform tests to find out what caused the seizure. They might also use EEG monitoring to track brain activity and guide treatment. The outlook for someone with status epilepticus depends on how quickly they receive treatment and what caused the seizure. Prompt action can significantly improve outcomes. The goal is to stop the seizure as soon as possible to prevent lasting brain damage. Prevention is key for people with epilepsy. Taking medications exactly as prescribed, avoiding known triggers, and having a seizure action plan are essential steps. Educating family and caregivers about recognizing seizures and knowing how to respond can save lives. Developing a clear plan that includes when to call emergency services and how to give rescue medications helps everyone feel prepared. Remember, status epilepticus is a medical emergency, but with quick response and proper preparation, many people recover fully. Always consult healthcare professionals for personalized advice and follow local health guidelines. Being informed and ready can make all the difference in managing this serious condition.